So welcome. I'm sorry, I look a bit bemused because it normally says this meeting is being recorded, and I didn't hear that. So, but it does look like it's being recorded. So I think that's fine. So I just want to welcome my speaker today, Shalom. Shalom has so many letters after her name and achievements and things that she's done that actually, to be honest, I've got it right here and normally I'd read it out, but I think I'm going to let Shalom tell you about herself because there's just too much for me to say. So with that said, thank you again for everybody coming. I'm still letting people in, so there's a lot of people coming to this event today, which is lovely. And over to you, Shalom.
Shah, thank you so much for having me. Can you hear me? Can you hear me all right? Oh, wonderful. I'm sorry, everyone, for the can you hear me's.
Yeah, we can hear you. Thanks.
Brilliant. Thank you so much for having me. Really appreciate being here as part of this community. I think what Cancer Care Parcel does is really amazing. So yeah, without further ado, I'm going to kick off and hopefully as part of this introduce myself to you as well. Let me share my screen now. If at any point you cannot hear me, please do let me know. Hopefully also you can see my screen now. Excellent. Wonderful. I appreciate really being invited to talk about healing and protecting your skin during cancer treatment. My name is Shalom Ijoma Lloyd, and I wear, as Shara said, I wear multiple hats. I run two incredible companies. The first company I run is as the founder and chief strategy officer at a company called EMQT. And I am also the founder of a great natural skincare company called Naturally Skincare. Um, this is me. I'm first of all a proud mother of five incredible children. I have spent the last almost 29 years now in the global pharmaceutical industry, working in clinical development, drug development, clinical trials, clinical research. And I usually say to people that if you cut me open, I bleed the pharma industry. I'm an honorary professor at the University of Buckingham. And one of my proudest moments this year was being awarded an MBE by His Majesty the King for my services to international trade and women in business. I'm a scientist, a TEDx speaker, and all those amazing things. Usually this slide is quite daunting for me, but I'm learning to blow my own trumpet as I get older, I think. So again, thank you so much for having me here. One of the reasons why I present this slide is because when you're talking, when you've invited to speak to to an event like this, you want people to start to build that trust with people and have that bit of credibility. It's really, I like the interactivity, and I know that people have their cameras off and there's a chat functionality, but please feel free to drop any questions, anything in the chat, and certainly try my best to answer the questions. So I'm going to start by the first company that I mentioned to you that I co-founded called Emerging Market Quality Trials, EMQT. This picture here is my father, John Alamezie Nadi. I was his only daughter, his baby girl. My father was a silent achiever. He was a butler for an Englishman when he was a young boy. And this Englishman saw something in this young boy and helped him get a Commonwealth scholarship, which was our link into the UK. And my father got this scholarship, and this is why kind of the dual nationality that we have. And he returned back to Nigeria, to Africa, to establish his own hotel chain. In 2009, I lost my father to cancer. So not only have I sort of been exposed to cancer and patients through my work, but it's also quite personal to me because my father passed away in Africa, in Nigeria, and there were no clinical trials for him to be a part of. And the reason why I'm showing this slide is because that was the reason why I founded this company, EMQT, to be able to give access, medicines access to cancer patients in Africa. And I just got back last week. I usually run four and free cancer screening events every year in Africa. We did cervical and breast just last week for over 200 women. The reason why EMQT is really important to me and relevant to this conversation is because I realize, like my father, patients of African descent who make up about 17% of the world's population are so underrepresented and not involved in clinical research or clinical trials. In fact, 95% of cancer patients in sub-Saharan Africa are diagnosed way, way too late. And soon Africa will represent a third of the world's population. That population will have drug naive patients across multiple disease areas. So I always say to the pharma industry, Africa cannot be ignored anymore. And I find that we in the Western world, I'm not sure where all of you are joining from, are somewhat fortunate. But we have to think about this as a global community and not in isolation. The second company that I run, one that I'm very proud of, I am a scientist, but I also believe in the strong power of nature. It's my company called Naturally Tiwa Skincare. The word Tiwa is an African word. It basically means owning your power and wearing your crown, the one who wears the crown. That's what the meaning is. And it means a lot to me. I founded this company it wasn't because I wanted to, have a skincare brand. I went through four cycles of IVF in 2014, and my fourth cycle was successful and gave me my beautiful and amazing twins who are now 10 years old. Unfortunately, one of my twins, my boy Joshua, was born with severe eczema where he was scratched till he bled. And I believe in the power of medicines. However, after I pumped myself through, you know, with chemicals through the IVF process, the last thing I wanted to do was put any synthetic chemicals on my boy. So, being my bonnet, I tapped into my African heritage, mixing ingredients in my kitchen, stumbled across what I call my Eureka formulation. And within 3 days, Joshua's skin started to become what it should have been from birth. And that was really the genesis of this company, how I started my company and got into the world of skin, the world of skincare that I have been obsessed with since this child was born. The main ingredient that I use in my products is shea butter. I'm sure all of you know shea butter, unrefined shea butter. It's an amazing ingredient. It's a humectant, occlusive, and emollient all in one. So forms the basis of everything I do in its unrefined and raw form. I'm a control freak by nature, and I wanted to really know where all the ingredients are coming from. Certainly, what worked for my son was the rawest of the rawest form of the ingredients. I remortgaged my home here in the UK and went back to Africa, went back to Nigeria, and we've got two share factories in Gwagwalada and in Esan Kingdom. These factories actually produce a lot of our ingredients, particularly the primary ingredients, which is shea butter. It's not aid, it's trade. I'm not in the world of philanthropy. But in terms of empowering these rural women, training education, and all those good stuff that really come with just doing business and doing things the right way. This is something that I'm extremely, extremely proud of. I'm also proud of the fact that I've built my organization, Naturally to West Skincare, on three pillars. At the core is efficacy, products that work using the power of nature. Great for people going through skin conditions, why it was founded in the first place, and people who are undergoing treatment. The second pillar on the far left, if you can still see my screen, hopefully, is planet hugging. Everything about this brand must hug the planet, from the natural raw ingredients to the packaging, being natural, vegan, cruelty free, and being sustainable. The third pillar is ethical sourcing. I've just talked to you about the work that we do in Africa in terms of our facilities. being able to pick up any of our jars and tracing our main ingredients back to the source. So these are the three pillars that I've built my brand on. So we're a proudly British brand using just Mother Nature's gifts without synthetic chemicals to really battle skin conditions. You don't have to have a skin condition to use a product, but we source our ingredients from Africa, manufacture, formulate, test, and package here in the United Kingdom. We're a brand with purpose and an impact in our DNA. What you see is what you get. So it's really for this reason that I'm here talking to you about skin. A lot of my customers, a lot of the patients that I see in the different clinics that I work with are patients who are going through skin conditions, but also patients who are undergoing cancer treatment. My two worlds genuinely have collided from the scientific side to the beauty side. So hopefully you'll find this engaging, take something away from it, and, just generally, hopefully enjoy it really. Some of these things will be a no-brainer for you, but there's no harm in reiterating a few things. Our skin is the largest organ in our body, absorbing over 60% of what we put on it. It's our protector, head to toe. And whatever we're going through internally tends to manifest itself on our skin. So our skin tends to tell us a story about what's going on, the side effects of treatment when you're going through cancer treatment. It's something that's not necessarily widely talked about, but I think we should bring that to the mainstream. The side effect of treatment, people going through skin conditions, I think they're no longer taboo subjects because I think skin conditions and treatments, they do impact the skin. But what I find most of all is that they impact confidence and self-esteem. I come across people who had beautiful and perfect skin, and then all of a sudden they're going through treatment or there's a trigger and the skin is seriously impacted and it really hits their confidence really, really hard. What my company is not, we're not a treatment, we're not a cure. I wanted to just make that clear what we're not. What we are is we help to manage and combat some of the side effects of treatment on the skin, help to manage skin conditions. And I believe in the power of natural ingredients to manage the soreness, the dryness, the itchiness, the sensitivity of the skin, using plant-based solutions and focusing really on skin health. So let's get into it. What we know. I have not met anyone who doesn't know someone or they themselves have a skin story. There is efficacy really in the power of nature. I won't put anything out there that is not vegan or cruelty free. Not all products, not just mine. Any product you put out there wouldn't work for everyone. It's about knowing what works for you. It's about listening and knowing your skin and actually understanding what's in what you're putting on your skin. I always believe that if it's good enough to eat, it's good enough to put on your skin. Nature or natural can be as effective and sometimes even more effective than the synthetic chemicals that we use. Quality for me trumps quantity all day, every day. There are not over 900 million people on our planet who suffer from a skin condition. In the UK, 1 in 5 children born with eczema. I always see skin conditions or skin impacted by treatment can be seen as a disability because of the impact it has on the mental health impact and also on the self-esteem impact that it has on people. I've seen that so many times. There are over 75% of patients on active treatment who undergo a form of skin toxicity. People experience things like dryness, you know, hyperpigmentation. The skin is really, really sensitive. Can I just check, Shara, can you still hear me? Okay, just thumbs up. Perfect. Thank you for that. When we talk about skin toxicity, it's really simply the ability of any substance to cause some form of reaction and impact the skin. It usually manifested after your treatment with cancer drugs and or reaction to cosmetics as well. So over 75 patients, again, 75% of cancer patients on active treatment experience something like that. It's a common side effect of radiation therapy, and it's quite high. Patients being treated early stage breast cancer. It's the most common adverse event or adverse effect from immunotherapy, up to 50% experiencing some sort of skin toxic symptom. This is not life-threatening, and we know that. However, as I mentioned, the impact, and if anybody kind of agrees, disagrees, please put it in the chat because these are things that, I always feel that we should really normalize and make this normal discussion because once your well-being, your mental health, your self-esteem and quality of life is impacted, everything seems to be impacted. So let's talk about and some people who are on this call, you might know somebody who's experiencing some of these impacts that happen. And these are the things that people are talking to us about, be it customers or patients, when you're going through treatment. The skin becomes really delicate because, the turnover of the skin cells slows right down, which can lead to a lot of dryness. So dryness is right up there in terms of how the skin is impacted. Healing, itchy skin, redness, the blistering, the skin becoming very, very, very sensitive. And when the turnover of the skin cell is slowed down, the skin, the natural oils that your glands will produce or secrete normally reduces, again, leading to dryness. There's dry skin and there's dehydrated skin. When you talk about dehydrated skin, is a skin that lacks water, simply put, and dry skin is a skin that lacks oil. So when those natural oils, the glands that secrete those, when they start reducing, the dryness comes in. If you have lighter or paler skin, it may turn red, and darker skin may even turn darker or have that dark patches. Sometimes if you're going through radiation, you can have that sort of burnt skin effect or look and feel, having swollen skin, and it can have sores that could easily get infected. And this kind of leads to, a risk of developing further issues with your skin. So people might experience some or or none of this. It's really very individual, but we know that a significant number of people undergoing cancer treatment have their skin impacted. I've mentioned this before in terms of how the skin, reacts to treatment in terms of by reducing the sort of the glands that secrete your natural oils, it slows down, etc. So it helps to use heavier moisturizers more often. The things I say to patients is please avoid hot showers. Do not use harsh soaps because your skin is really going through so much. Avoiding synthetic fragrances. The more natural you go, the better. A level of gentle, very gentle exfoliation to sort of get rid of the dead skin cells on the surface of the skin is really important. Please don't use alcohol-based products because they tend to even dry out your skin even further. Sunscreen, I know we say this all the time, but please, sunscreen is vital because what you're doing is protecting already vulnerable skin. If you don't take anything away from this slide that you can see here, please take away one thing. Moisturize, moisturize, moisturize. Again, please feel free to kind of, chime in the comments. Let me know what you're going through. Let me know what your thoughts are. You could disagree, you could agree. That's absolutely fine. We're kind of all here to learn and grow and share information. The reason why I started my brand was for skin condition, but what they do for you is to moisturize and help that battle and tackle that dryness and flakiness. Having products that won't, and it doesn't have to be up, it could be any product. So just please bear this in mind when you're out there looking for a product. Products that won't strip your skin of its natural oils, that enhance and feed your skin. Rich products that will do that. You might be used to or not used to sort of really rich products, but little bits go a long way. And always look at the ingredients. I can't stress it enough. Educate yourself. Know exactly what you're putting on your skin. People are going through so much with treatment. Remember, if it's good enough to eat, it's good enough to put on your skin. You want things that actually reduce inflammation, that are packed with antioxidants, that would help reduce the dryness and the itching. If you remember, what triggered me for my son was I wanted to do one of three things: reduce his inflammation, the redness, and his itching. Don't introduce more chemicals if you can help it on your skin. It absorbs over 60% of what you put on it. So it's just about, really, dare I say it, it's really common sense. But I know that people are going through so much, but it's just about bearing these things in mind and loving your skin. Again, is the largest organ in your body. I wanted to show some results. What they say, a picture speaks 1,000 words. And actually looking at this is what gives me joy. This really gives me life. This is really seeing the impact of actually using the right products on your skin. Not everything will work for you. Find what works for you and stick to it. Things don't have to be clinical. And some of these pictures are graphic, I'm sorry. Some people are quite squeamish, but I do like to show the reality. Remember when I said about skin conditions impacting self-confidence and self-esteem? This is what I mean. This is reality. This is what people are going through on a day-to-day basis, you know. And you can just have, remember I said, it could be one of these things that you experience, or it could be all of them or multiple of those, effects or side effects that you could experience. Here are children. This one breaks my heart a bit more. Again, but a picture speaks 1,000 words. It's really about this is the reality. This is why I say skin conditions can be a disability. So here, the products that we offer: exfoliate, wash, moisturize. I'm not here to sell you my products. It's really to talk about your do's and don'ts, what you should do and what you shouldn't do, regardless of which brand, which product. Again, I can't stress it enough. Your skin is the largest organ in your body. Please, 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 please know exactly what you're putting on it. So can I pause here for a second and see if there's any questions? I know that, people don't like
No
the cameras
questions
on.
yet.
No questions, any
Not
comments?
yet.
Come on, people, give me
Please
something.
do.
Give me.
Yeah. Please. Yeah. If you're not, yeah, just ask any questions, and I'll ask them at the end, or I'll pose them to Shalom. So yeah, please. I reiterate what you have to say. Yeah.
So brilliant.
Nothing yet.
Okay, thank you so much. And for us, it's really what I try to do is bucket really which of my products are good for the different skin problems that people have, whether it's dry skins, cancer-related skincare issues, hypersensitivity, itchy skin, inflammation, redness, hyperpigmentation, and really we do the same thing for people going through skin conditions: eczema, psoriasis, dermatitis, keratosis pilaris, very sensitive skin, etc. I'm feeling like I'm whizzing through this very, very quickly because I'm really coming to the end of this. Normally, I'm used to interaction and people asking me lots of questions during this, but that's absolutely fine. Absolutely fine. One of the things that actually drives me is consumer preferences, actually knowing what people out there are looking for. It's no longer enough to just be vegan and cruelty free. Consumers who are going through skin conditions or treatment that impact their skin generally want to know what's in their products. And for me, it's important that you're able to trace. The traceability is there. There's a lack of traceability in the industry. When you walk into a store, I'm sure a lot of you experience this. There's just options. We're spoiled for choice. You walk into a store and you think, well, where do I start? What do I do? Where do I go? It's just to give you a guide of what people are looking for out there. It's really building that trust with a brand, knowing that there's transparency, knowing that you can actually impact the value chain. Waste is a big deal in the beauty industry. 120 billion unrecyclable plastic units produced by the beauty industry every single year. So I would say also bear that in mind. I've mentioned about skin conditions and treatment impacting emotionally and sort of mental health. Labeling is important. I can't stress it enough. Please turn it around and read the label. Know what's in it. Know what you react to, what your skin reacts to, what you're allergic to. Because sometimes being allergic to certain ingredients, if you're anything like me, can actually happen with age. You can go through life thinking, no, 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 I've not been allergic to anything. And all of a sudden, for example, during COVID, we had a lot of people all of a sudden break out and had their skin impacted because of the external stress factors, right? And differentiation is really, really important. So this is, I'm going to skip this one because this talks about us being B Corp certified and what we bring to the table, and sort of our industry accolades again, in terms of what we do and who we are. So I've come to the end of my slides, but
There are questions. I've asked a question as well. So,
oh,
but no, there are quite a few questions actually. So, if anybody else has some questions, I think that was very clear actually. It was very clear, and I wish somebody had spoken to me about moisturising during my radiotherapy. It was when, whenever I talk to anybody now who has radiotherapy, the first thing I say is moisturize before, moisturize during, moisturize after. I mean, that's actually what the question that I said was, do I still need to worry about skincare after my treatment, which nobody
oh,
told me, so I wanted to ask.
no, absolutely. I
Mm,
always talk that barrier, your armor, that's your skin, right? So I just think you get out of it what you put into it.
mm,
So be it
mm,
during treatment, after treatment. And one of the things that I do like is when you find something, a lot of people don't tend to want to use the same products that we're using through treatment, right? Because it kind of triggers. So having something that's natural, clean and green and just suitable for people who are undergoing treatment or not undergoing treatment. So I would say,
mm.
please carry on. Do not stop looking after your skin after treatment.
But would you say to still use the same? So you said to use the same products, like you've just said that, yeah,
You,
to
you
still
can
use the
use the
gentle
same
products,
products. It
yeah.
doesn't, yeah, you can use it as long as you know what it is. When you find a product that you know what's in it,
Mm,
you've built confidence in that particular product, right, or particular brand,
mm,
and you know your skin loves it and reacts well to it.
mm,
And you know that you don't react to any of the ingredients, etc. Why not?
mm,
Why change?
mm. I'm going to go through the other questions. We've had quite a few questions after you asked people to ask questions, so thank you.
Oh,
That was
thank you
good.
guys for
Yeah.
asking questions. I appreciate that.
And please also anybody else put some questions in if you want. So we've got our first question is, how careful do I have to be during and after radiotherapy with the type of product that I'm using to moisturize? So,
Very good question. I think that one of the things I say to my customers is because there's no synthetic chemicals in anything that we put out there, you can slather it on as many times as you want to, as many times as you need to. I think it's when, what I'm projecting on the screen now, when you're using things like alcohol-based products, I'm not saying they don't work. It's down to preference sometimes, you find that your skin reacts better to something with a little bit more aesthetic chemicals in them. So it's really down to what your skin is reacting well to. But if you go down the natural route, one of the advantages of that is that you don't have to worry about how many times or how much. Does that make sense?
But what's wrong with alcohol-based products?
When I talked about stripping your skin of its natural oils, your treatment, if you're undergoing treatment, it's already doing that, reducing the natural oils that your skin produces. What tends to happen more often than not with alcohol-based products is that they further dry out your skin. So we're saying moisturize, 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 and then using something that would dry out your skin or reduce the natural oil that your skin produces is counterproductive.
So what about toners then? Do you not think like toners at all? Because they're not. Isn't that what
I think
toners? Oh,
I think toners are great, but you
oh.
do have toners that are not alcohol based.
Ah, okay. Right. Okay. Um, so the next question would be, would you call your products treatment specific products? And is there a real difference between these and mainstream?
Hmm. Very, very, very good question. We're not a treatment. What I wanted to create was an everyday go-to, like an everyday moisturizer or body wash that you can go and use on a regular basis and not actually feel like you're still undergoing treatment. The difference between what I produce and mainstream is exactly what I've said before in terms of you can pick up a jar of any of our products and be able to trace the ingredients where they come from, all raw, all natural, not refined at all. Because for me, that's where the authenticity and the efficacy of our products lie. It's in the rawness of the ingredients. I mean, you have people can say, "Oh, it's natural," or but we have very strange products, I have to say. They're waterless formulations. I don't use water to make my products. So you're getting the full impact of the raw ingredients. And that's really, really important to note. Most products out there, when you look at the ingredients package, the first thing you see is aqua, water. Most beauty products can contain anything between 40 and 70% water. Our moisturizers are completely waterless. So you have a full 250 ml jar, and a little bit goes a long way because it's a waterless formulation. So those are some of the differentiators for us. That's really
So
important.
are you, would water be bad, or are you just saying that yours is more concentrated because it doesn't have water? Yeah, so it
Correct.
goes
The
along the way.
water is certainly not
Yeah,
bad.
yeah.
Certainly not. But we find that we're not diluting. We have the
Mm.
concentration is certainly there, so you're getting the full impact of the products. Yes.
And are there any specific ingredients that are really good
Oh, for
for people
me,
with cancer?
yeah, for me, I mean, if you look at a lot of products out there, I think one of that's why I'm obsessed with the ingredient shea. Shea butter is fantastic. As I mentioned in the beginning, it's one of those few ingredients that's a humectant, occlusive, and emollient all in one, attracting moisture, locking in moisture. Again, hydrate, hydrate, moisturize, moisturize, moisturize. So you have this ingredient that, I talked about dehydrated skin that lacks water and dry skin that lacks oil. Shea butter is one of those ingredients that actually will help hydrate your skin as well as battle the dryness. So I'm biased really. I'm totally obsessed with this ingredient. And I've seen what it can do for patients who are undergoing treatment.
Mm.
Absolutely.
We've got two other questions, but I've got before I ask those two other questions, you said there were three things: emollient. What were the other two things?
It's an emollient,
Emollient.
occlusive, and a humectant.
So can you explain what those three things are?
Absolutely.
Yeah.
Can you still hear me okay?
Yep. Yep. Yep.
Excellent. So your emollient is your usual sort of moisturizer, the hydrate that you get prescribed or given when you go to see a doctor for skin conditions. Humectant is really attracting moisture and locking it in. And the occlusive is ability to penetrate the levels of the skin, if that makes sense. So you have this ingredient that attracts moisture,
Okay.
locks in the moisture, and is able to penetrate the different levels of the skin.
Ah, so does that mean when you get a just a emollient that it's not necessarily going to, it's not so good because it's not being pushed in and sealed and all that, that you just
It's not that it's not, it could be, sometimes you have moisturizers that do one of the three,
mm,
or ingredients that do one of the three, or you have something that actually does all three.
yeah,
So it's able to do all of that.
yeah,
When you say that something is occlusive, it means that it's forming that protective layer. So when I
mm,
say locking and sealing, it's actually locking it in, that
mm.
occlusive effect or ability of a moisturizer to actually lock in the moisture on the layer of your skin.
And just back to radiotherapy because that's what I've got the most experience with. Um, in general, in the UK, and I don't know where everybody else is from, but you're recommended to use an emollient um, uh, to prevent the burns and to help with the moisture. But is that just sort of basic, and you should really be having the other two
Well,
included as well? To
a humectant, for example, will the ability that humectant ability of a moisturizer will help increase retaining moisture
mm, mm,
in
mm,
your skin, whereas an emollient will sort of moisturize, but then you have the occlusive bit that actually locks it in and protects it,
mm,
and a humectant will help you retain it,
mm.
penetrating the levels of the skin and retaining that moisture.
Yeah. Okay. All
Does
right.
that make sense?
It does, yes. And is it so? No, I'm going to stop off. So we've got other
That's fine.
questions before. So what? Somebody says I have greasy skin in general, so I'm not keen to moisturize. Do you,
Very, 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 very good point and good question. It is a myth that when you do have oily skin, that you cannot use oil-based products. Of course, it depends on the type of oil-based product that you're using. But it is not, I don't believe it's true that if you have oily skin, you cannot use oil-based products. And I think if the person who asked the question has oily skin and they're saying that okay, that their skin is producing enough oil, then I think they'll probably need a lighter moisturizer, if that makes sense, as opposed to something heavy.
and
Remember the
why would they need a moisturizer if they're producing enough oils anyway?
if you're producing enough oils for your
Well, not
skin, but
enough,
you
a
still
lot of,
you,
yeah.
you kind of still need to feed your skin. There's still going to be impact of different impacts of treatment on the skin. You make it a habit to cleanse your skin and moisturize your skin to help actually feed the skin and retain um, the
Mm.
oils.
Does cleansing dry? Can you cleanse without drying the skin?
Oh yes, absolutely you can. You
Oh.
can again you can use you know what I mentioned, finding the right products for your skin is really, really crucial.
Mm.
There's so much choice out there. You can find cleansers that are you know, cream that are cream or that are oil based. There are some cleansers that are really alcohol based and they wash off and they do cleanse the skin, but they also dry out the skin. There are so
Mm.
many cleansers out there, options that would actually really nourish. What you're looking to do is nourish the skin while cleansing the skin. Yes.
Mm. Okay. And then we have another question, which is I thought exfoliation was not good for dry skin.
Very interesting question. You know, the skin I mentioned earlier, skin regeneration is very, very it's real, right? Your skin turns over your skin cells. When you're going through treatment, sometimes that really, really slows down. What exfoliation does is exfoliation helps you actually open your pores and get rid of the dry skin cells at the surface of the skin. When you say exfoliation, people are thinking about, really harsh going for it. The gentle exfoliators, exfoliants out there that will just help to sort of clean out the skin, open the pores, get rid of dead skin cells that will allow other products like the moisturizer, whatever else you use, to be absorbed nicely into the skin.
So, what sort of skincare routine would you recommend when we're talking about exfoliating? And I mentioned
Mhm.
toner and that sort of thing. Is there some for, um, would it be different for someone undergoing chemo, radiotherapy, immunotherapy? Would you recommend the same? What's your thinking on that?
The I'm very sort of I'm quite a lazy person. I'd like things to keep things very, very simple. And I still do the sort of exfoliate, wash, and moisturize. That is my standard routine, right? I exfoliate once a week. When you're going through treatment, you don't have to exfoliate. You could exfoliate once every couple of weeks. The key thing is the type of product that you're using. The gentler the product, the better. Gentle exfoliation, a polish, really, not even a scrub. A polish is amazing because with some exfoliators, you're polishing and exfoliation and moisturizing at the same time. So you're actually opening up the pores and allowing the products and the moisture to actually be able to penetrate the skin and be absorbed in the skin.
And would you treat would you say do the same thing? Is there anything special you should do for a different treatment? Immunotherapy, radiotherapy, chemo?
What I found is feet, hands and feet. A lot of people do complain about hands and feet as well. And the exfoliation, the gentle exfoliation should be focused on those areas that you're actually having a lot of difficulty with. You know, all the symptoms that I listed out there, some people would experience only a few of them. You can't have sores and open wounds and exfoliate. That's just not,
Mm.
you can't do that. But some people have sort of excessive skin on their feet and really excessive dryness, I should say, on their feet and sometimes their hands. And then I would recommend exfoliation.
Right. Okay. And what would you do with sores, like radiotherapy sores and stuff?
Again,
Or should
it's
you just leave
this.
them? Yeah.
Let's go back to the humectant, occlusive, and an emollient, right? This is where the ingredient really matters. This is why I'm obsessed with shea because it helps to create that barrier, almost that skin protection, almost that film, allowing your sores to heal.
Mm. Okay.
So even if you get hold of raw shea butter, it's absolutely fine. You don't have to go and buy a product, whatever. Raw shea butter. It's for me, it's really the rawness and the authenticity and the cleanliness of the ingredients that really matters. And also knowing your skin and knowing what works for you. Knowing your body is really, really important. It's going through changes, right? Because when I see one patient is different from another, they might be going through the same treatment.
Yeah. Yeah. Okay.
Oh, somebody's got their camera on. I love it when somebody's got their camera on. It's quite nice
Yeah.
to see a face.
um. Um. Well, actually, that's all the questions that we've got so far. If anybody else has any other questions, that would be great. There's a lot that I could ask actually, and I just wanted to. Can I? This is all about me. So if
No,
anybody
that's
else has some
absolutely
questions,
fine.
but I'm just when you spoke about your skincare routine,
Hmm.
you missed out toner, and I just wondered whether there was. I mean, I'm obviously talking about the face now, and not
Yes.
chemo, sores, or immunotherapy, but um, you in general you tend to get dry with these treatments, and I just wondered what is the value of toner? You didn't mention it when you in your skincare routine.
Honestly, I didn't
So.
mention it when I didn't mention it because I don't necessarily use a toner.
Mm,
So a facial toner is typically I'm trying to make sure I kind of give you the right information here, is typically used for tightening the pores. You know, when you kind of wash, when you cleanse, kind of tightens the pores and helps cleaning the skin surface to remove excess oil
mm.
from it. Um, I don't necessarily tone. I just wash in the morning, use my cleanser, and use my moisturizer. Some people love to tone because, again, the lady who asked the question about oily skin, I find that people with oily skin tend to cleanse and tone and then moisturize.
Mm,
And that makes sense.
mm. And have you got any advice for people? This isn't quite skin, but any advice for people who have brittleness of their nails and things like that off with treatment? Or is that not quite? Because I'm thinking of my hand creams that when I moisturize, it
Mhm,
helps with my
mhm.
nails. Is there any sort of specific chemo sort of brittle nail advice that you have?
I think a lot of there's a lot of things out there that they kind of do specific products targeted at specific parts of the body. When you find the right moisturizer for your skin, use it for your nails.
Mm,
When you find the right, and it's really what you put in is what you get out. Massaging into your cuticles,
mm,
and being able to, again, the right ingredients. When you find something that attracts moisture, locks in moisture, and moisturizes the skin, why can't you use it for your nail beds? Just give it the attention that it deserves. I know some people who actually put, when they find the great moisturizer, actually put it on their hands and put gloves on so that it'll actually sort of deeply penetrate into the skin. It's really about looking after your skin.
mm. And there's nothing sort of contraindicatory from for um, nail or hand or dry skin treatment from mainstream products then that you would say, except that avoid the
No,
alcohol, try to be natural,
absolutely.
don't have, yeah,
It's really finding what I can sit here and say, oh, my products are great. It's about finding what's right for you. You might use my product, Sharon, and think, oh my God, no, 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 don't like it, don't like the scent of it's finding what is right for you as an individual, taking the time and knowing what your skin reacts to and knowing what your skin craves really. And once you
mm,
find it, you stick to it. And once you find it, it works for your body. Like I mentioned about the skin, I keep hammering on about it, but don't treat the skin differently. The skin, from head to toe, we're covered in skin. You
mm,
just find areas in the skin where, like I talked about hands and feet, you find more dryness than the other. Give them that special attention. But
mm,
otherwise, just know exactly what you're putting in your body.
mm, mm, mm. Okay, well, thank you. When you showed us those pictures, I was just wondering which ones, what I didn't know what the issues were, whether they were radiotherapy, whether they're chemo, the immunotherapy, eczema, but it was very
Yes.
interesting to see the befores and afters.
Yes,
Um,
I try to, in some cases, in some audiences that I talk to, they're okay with it. And some people are very, so I can't see who I'm talking to. Some people are kind of like, kind of move it along, or some people are
yeah,
all right with it.
yeah,
What I do love is when all those pictures are what customers have sent through to us.
mm,
The first, I know the face that I showed, the lady's face, she was going through chemo.
mm,
And that was really a really horrible time for her. This is somebody who had amazing hair, amazing skin, and all of a sudden, all that just poof
mm.
got impacted. So yeah.
And how long would it take with that skin from chemo? How long did it take with all the intense moisturizer to get it to calm down?
For that particular lady, it took 10 days, which is very quick. When
Mm,
people ask me about timelines, I'm quite reluctant to talk about timelines because, we all react to different things very, very differently. And we live in a world today where people are looking for, I want it to happen yesterday.
mm,
You've got to invest time and effort to be
yeah.
able to get the sort of results that you're looking for.
Mm, okay. All right. Well, that's perfect timing. Loads of information. Great slides. Thank you. If there's no other questions, I'm going to stop the recording.